Navigating gum disease treatment costs, Europe versus Turkey. Gum disease, also known as periodontal disease, is a common oral health condition that affects millions of people worldwide. It is caused by the accumulation of plaque and bacteria on the teeth and gums, which can lead to inflammation, bleeding, and ultimately, tooth loss if left untreated. Treatment for gum disease can vary depending on the severity of the condition, but it typically includes professional cleanings, scaling and root planing, and in some cases, surgery. One of the biggest concerns for patients with gum disease is the cost of treatment. In Europe, the cost of gum disease treatment can vary significantly depending on the country and the severity of the condition. In countries like the UK, Germany, and France, the cost of gum disease treatment can be quite high, with some patients paying hundreds or even thousands of euros for their care. This can be a major barrier to treatment for many people, especially those without dental insurance or who are on a limited budget. On the other hand, Turkey has become a popular destination for dental tourism in recent years, thanks to its high-quality dental care at a fraction of the cost compared to many European countries. Many patients with gum disease are now choosing to travel to Turkey for their treatment, as they can save significant amounts of money while still receiving excellent care. So, how do the costs of gum disease treatment in Europe compare to those in Turkey? Let's take a closer look at the factors that can influence the cost of treatment in both regions. Cost of living. One of the main factors that can impact the cost of gum disease treatment in Europe is the cost of living in each country. Countries with a high cost of living, such as the UK, Germany, and France, tend to have higher healthcare costs, including dental care. This can make gum disease treatment more expensive for patients in these countries, as dental clinics must charge higher prices to cover their overhead expenses. In contrast, Turkey has a lower cost of living compared to many European countries, which means that dental care is generally more affordable. This can make a big difference for patients with gum disease who are looking for high-quality care at a lower cost. Labor costs. Another factor that can influence the cost of gum disease treatment is the cost of labor. In Europe, dentists and dental hygienists are typically well-paid professionals, which can drive up the cost of treatment for patients. Additionally, the cost of training and education for dental professionals in Europe is often quite high, which can also contribute to higher treatment costs. In Turkey, labor costs are generally lower compared to many European countries, which can make dental care more affordable for patients. Dentists and dental hygienists in Turkey are still highly trained and qualified professionals, but their salaries are typically lower, which can result in lower treatment costs for patients with gum disease. Insurance coverage. The availability of dental insurance can also play a role in the cost of gum disease treatment in Europe versus Turkey. In many European countries, dental insurance is not always included in standard healthcare coverage, which means that patients may have to pay out of pocket for their gum disease treatment. This can add up quickly, especially for more extensive treatments like surgery or dental implants. In Turkey, dental insurance is more common and can help offset the cost of gum disease treatment for many patients. Some dental clinics in Turkey also offer payment plans or financing options to make treatment more affordable for those who do not have insurance coverage. This can make a big difference for patients who are concerned about the cost of their care. Quality of care. While cost is an important factor to consider when choosing a dental clinic for gum disease treatment, it is also crucial to prioritize the quality of care. In Europe, patients can typically expect high standards of care and professionalism from dental clinics, which can provide peace of mind during the treatment process. In Turkey, the quality of care is also generally high, with many dental clinics meeting international standards for cleanliness, safety, and expertise. However, patients should still do their due diligence when choosing a clinic in Turkey to ensure that they are receiving the best possible care for their gum disease. In conclusion, the cost of gum disease treatment can vary significantly between Europe and Turkey, with Turkey offering more affordable options for patients in need of care. Factors such as the cost of living, labor costs, insurance coverage, and quality of care all play a role in determining the overall cost of treatment. Patients with gum disease should carefully consider these factors when choosing a dental clinic and weigh the pros and cons of each option before making a decision. Ultimately, the most important thing is to prioritize their oral health and seek treatment from a qualified dental professional, regardless of the cost.